Welcome to the Learning Lab. My name is Roman Garcia. Today we're going to be talking about arthritis. Now, the reason we're doing this particular video and we're dedicating this topic to this volume is that in my experience throughout my years of practicing physical therapy, what I've noticed is that when I start talking to a patient and try to discuss their arthritic condition, I get the sense that there's a bit of confusion in that patient as I try to discuss and teach them what arthritis is and how it's formed and how it's defined in the medical literature. Now, what I've noticed is that a lot of these ideas that these confused patients come to the clinic with are the result of interaction that they've had with their MD that has diagnosed them with a particular arthritic condition. Now, what I find fascinating is that if the patient is confused because of what the doctor told them, I can only assume that the doctor is also confused about arthritic condition and how the mechanism of arthritis develops inside a patient's and the patient's joints. Now, what I want to do is I want to clarify and make very clear the mechanism of what arthritis is when it starts to affect, or how it affects, the human body. Now, what I've done is, if you come over here, is I've laid out a schematic of how arthritis forms and what each word literally means in the medical literature. Now, when arthritis, now there are different phases of arthritis. Each phase has a different word which defines what the state of the joint it is in based on what phase of the degenerative process that joint is in. Now, and like I said before, each phase has its own defining terms. But what I found out by talking to patients is that there is a large confusion in the medical profession of how arthritis forms inside people's joints. And the doctors, as much as the patients, are completely confused of the way that arthritis is being described to the patients themselves, or how arthritis is being used to describe a tissue states. Now, what I want to do is I want to clarify so the folks who see this video understand completely the different phases of the degenerative process that afflicts the joints and what terms or what are the right terms to use to define or to describe each particular phase. Now, there are three different terms that can be used to define a degenerative state in a joint. Now, what I've done is I've used the three different terms and I put them in the order of occurrence. Now, before an individual develops degenerative joints, the first symptoms that they are going to experience is pain. Now, when a person experiencing pain in their body or in a joint, the proper medical terminology is arthritis. Because what arthritis means is the joint is irritated or the joint is inflamed, thus causing pain. The second term is arthrosis. Arthrosis means, it does not mean pain, but it means that the joint has undergone a change that has taken them away from what a normal joint looks like. And then the third term, which is rarely used by MDs to describe arthritic changes in knees, ankles, hips, is degenerative joint, of which I believe this is the proper term to use to describe a joint that in current medical terminology is being described as arthritic. Now let's go through the phases again. The first phase is pain, which is arthritis. The second phase of joint that's undergoing a change, a degenerative change, is arthrosis. And the third is a degenerative joint, which is the end stage of a joint that's undergone a particular form change which leads to consistent pain. Now, Carlos, you can come back to me. I'm going to make it a little bit clearer, and I'm going to show you this concept, but in a picture format, and with the help of my assistant, I'm going to show you exactly how you out there that's watching this video can define for yourself your own joint to discover whether in what phase of the degenerative process you're in, whether you're in the arthritis phase, the arthrosis phase, or you're in the latter stage of the degenerative process, which is you're in a degenerative joint phase. Now, the reason I think that this is important, it sounds a little bit complex, but it's not, is because each phase of the degenerative process, if it's not defined properly, then you're going to be getting some misleading information from the individual that's examining you and giving you a diagnosis, because each phase of that process comes or should come with different type of advice, so you can understand and better deal with the phase that you are currently in. Because each phase, eventually, if you do not do the proper protocols, will eventually evolve into the more severe degenerative joint phase. And as you keep evolving towards the severe side of the spectrum, in order to reconstitute changes in your joint becomes more difficult and takes longer periods of time. So the clear that your condition is defined and put in its proper category, the better the odds, the greater the probabilities that you're going to be able to institute a program so you can reconstitute that joint. But the first step, the first process is defining it properly. And in a little while, I'm going to show you some examples of some patients that I examined, each experiencing a different, each being at a different point in this evolution onto a degenerative joint, and the symptoms that accompany these patients. But the first thing I'm going to do is, with the help of my assistant Anna, we've been through this before, but I'm going to show you a quick sample, or a quick, I'm going to show you how you can define a joint that's in an arthritic, an arthrosis, or in a degenerative state with the help of my assistant Anna. Anna, you're going to lay down. Now, we know, we've examined, Anna's been in all my videos, and we know that Anna does not have arthritis in her knees. We've seen it, and I'm going to show you in a little while how her x-rays look. We know that Anna does not have arthrosis. But Anna does have arthritis because she periodically complains of pain in her knee. Now, if you do a clinical examination of Anna, it's very clear that Anna biomechanically has healthy joints for her. You can see that she has full extension. She actually has hyperextension, which is both good and bad. This is what produces her arthritis, it's this hyperextension. If Anna would be in the arthrosis stage, her biomechanics would be compromised. She would not have this biomechanical extension. It would be affected. But Anna does complain every now and then of pain in her knee. Now, if she were to go to a regular doctor and she were to be examined, she would most likely be told that she has arthritis, making her believe that she has a joint that's in a state of degeneration. But the truth is far from that. If you follow that stage that I just described, a joint that's under duress has 3 different phases: arthritis, arthrosis, and then be in the degenerative state. Anna is in the first stage. If Anna were to come to me as a patient, because I know that she has arthritis and not arthrosis, just based on the clinical examination, the advice that I will give Anna will be completely different than someone who would come to me with either arthrosis or be in a degenerative state. the advice and the recommendations would be completely different for Anna versus somebody that's in one of the other two stages. Now, what I'm going to show you is the first stages of arthritis going into arthrosis. Anna, lay on your stomach. For all of you out there, this is a very telling system or symptom. Anybody that has been in the arthritis phase and moving into the arthrosis phase, one of the first symptoms that they will experience, for all of you out there, for you to keep in mind, is that they will experience pain right back here. Right back here. Anna is not expressing it, but this is uncomfortable for Anna. It's a little bit tender for her. If you start experiencing pain right back here, you've been in the arthritis phase for a long time already, which Anna has been. And she's starting to move into the arthrosis phase. There's starting to be changes in her joint form, in her joint structure. So anybody that's watching this video, if you are experiencing consistent pains in the back of your knee, right back here, it's time for you to get a knee checkup, because you have to be evaluated to determine whether you are experiencing and you are starting to move into that arthrosis stage. Anna, turn on your back now. So pain in the back of the knee is a very telling sign. Now again, as we examine Anna's biomechanics are relatively normal. Now Anna is a knock knee. We know that from prior examinations. And I'll show you a picture of her x-ray. Anna is going to experience, as she gets older, if she does the wrong things and she's given the wrong advice, Anna will experience arthritic changes right out here. The probabilities of her experiencing arthritis are very high. Her experiencing arthrosis or degenerative joint changes out here versus on the inside because of her knock knee pattern. But right now, Anna, the advice that I've been giving her, Anna will not progress to the arthrosis stage because she follows my advice. She understands what the future may hold if she does certain activities. Now, what I'm going to do now, Carlos, we can go over here. What I'm going to show you is x-rays of different patients that I've worked with. One of them is Anna's. And the symptoms accompanying these patients. Now, the interesting thing about arthritis is that you may progress into the arthrosis stage where you actually see changes on an x-ray and not have to go through the arthritis stage. The arthrosis phase will sneak up on you. That's why it's so important that when you go have a medical checkup of your knees or your knees to be examined, it has to be somebody that understands the differences between arthritis, arthrosis, and the degenerative stages of tissue states. Or else, you may be given, or you will be given, misleading information and recommendations which may not apply to you. Now, let me show you this first x-ray. This is the most interesting x-rays out of the three. This x-ray right here is of a professional athlete. As we speak, this individual is still performing at a very high level. Now, the interesting thing, this is a classic example of someone who has arthrosis but didn't go through the arthritis stage. He complains mildly of knee pains. It's the only reason we were able to get this x-ray and he allowed us to examine him. But this is an elite athlete who's performing as we speak. Now, when we did an x-ray and I examined him clinically, there was very little biomechanical flaw in his knees, and he was complaining of very little pains, and it wasn't every day, just a mild ache in his knees. But when we x-rayed him, this is what turned up. Now, this is the interesting thing. To the unprofessional eye, this x-ray probably doesn't look that bad, but to a trained eye, this is a knee that is that looks as if it's under a lot of duress, which it is. Technically, this x-ray would qualify as somebody who should be in pain. This x-ray shows arthrosis. It shows structural changes within the tissue state itself. I'll show you, and when you see a normal x-ray, you'll be able to appreciate the difference. This is the inside of the knee. This is the inside. This is the outside. Now, as you can see, and you'll see the difference when I show you a normal, this is the tibia, this is the femur. You can see how hollowed out this bone is right here. You can see the joint space width right here. It's kind of whitish. This knee does not have the full complement of cartilage. This is the right, this is the left. We'll stick with the right still. You can see on the outer side over here, again, this tibia right here, this surface is flattening out. Normally, it should be concave. It should be like this. This bone right here, this is the femur. This is the top bone of the knee. It's almost making contact with the bottom part. He's lost a lot of cartilage on the outside part of his knee. If we go to the left, the pattern is the same. He has this hollow scalloped tibia. Again, you go out here, you see the actual femur is actually almost making contact with the tibia. There's still some cartilage, but it's a very thin veil of cartilage. This individual complained very little of knee. This is an individual that went through the arthritis phase, and went into and evolved into arthrosis. Now, the future for this individual does not look very bright insofar as whether he's going to experience knee pains in the future or not. The probabilities of this individual experiencing knee issues as he gets older are very high. Sooner or later, he's going to go into the degenerative phase, which will entail pain and structural changes. That's what the degenerative stage is defined as, is when you're experiencing both symptoms of the first two phases, pain and structural changes on x-rays. Then you end up with the degenerative state. Now, what I'm going to show you now is this is Anna's x-ray. As you can see, the x-ray looks relatively normal. We know that Anna is in a knock-knee pattern. These measurements right here tells us this line right here is crossing the inside part of the tibia. She's definitely in a knock-knee pattern, so she's susceptible to arthrosis. But right now she's in the arthritis phase only. She's experiencing periodic pains. She's not in arthrosis yet. There's a little bit of signs right here. You see this whitish right here? That's the sclerotic end of the joint of the tibia. She's experiencing a little bit of desiccation in the knee. She has a little bit of arthrosis, but mainly she's still in her arthritis, in the arthritis phase. She's not in arthrosis. So all her knees can be maintained like this if she follows my advice. Now, the third one I want to show you, this individual that I examined probably about 6 months ago. This individual was experiencing pain in her knee. When I examined her biomechanically, it was a healthy knee. Though she was experiencing pain, this individual was experiencing arthritis. But she's definitely not in neither the arthrosis phase and very far from the degenerative joint phase. This x-ray looks relatively healthy. It's a very healthy looking knee. As you can see, this is what I mean about the scallop. It's concave right here, but it's not excessively concave. So we're going to go back to the elite athlete. You can see the concavity right here and the convexity right here. It's a very well smooth line. There's no jagged edges. You can see all this cartilage tissue right here, all this black right here. This is all cartilage right here. She has a good amount of cartilage tissue. Now let's go back so you can appreciate the difference. Remember what I said. Look how deep this concavity is of the bone. This bone right here on this professional athlete is wearing out. It's literally collapsing. This gentleman is in the arthrosis phase. Now, I'm just going to show you one more time so you can appreciate the difference. Again, remember the changes from the professional athlete. And look at the difference. This is a healthy looking knee. There's pain in it. She has arthritis. The joint is irritated, thus the definition of arthritis. She has arthritis. She doesn't have arthrosis, and she doesn't have a degenerative joint. Okay? Carlos, ¿te puedes parar sentado? Siéntate. All right. So basically what I'm describing is it's a new paradigm for how to evaluate and how to pass on information to your patients or to individuals. Because as I've experienced when I speak to individuals, to patients, as I'm talking to them, they use arthritis liberally. And they're using it incorrectly. And the only reason they're using it incorrectly is because the doctors themselves have gotten kind of lazy, where they're explaining what arthritis is and what the definition really means. And the problem with that is that they're giving false information to their patients. And it's all about the proper information at the right time, because each phase of the degenerative process requires a different level of protocol in order to deal with the symptoms and the structural, the biological state of the tissue itself. If we start using arthritis liberally, as we're doing now, we start confusing at what stage of the degenerative process that individual is in. And the information that you give to an individual doesn't help at all. And if you've seen, I read different types of statistics, but in the United States alone, there are over 500,000 total knee replacements done on a yearly basis. And I think that number is rising geometrically. And the question I always ask is, why are there so many knee replacement surgeries being done? And I think the only reason that you can come up with, the only conclusion is that as medical providers, we are failing in really educating our patients on what they can do and what their future may look like if they don't take proper actions. But the only way you can do that is if you really define at what stage or what phase of the degenerative process that individual is in. And the only way you can do that is by using the terminology correctly. Again, anybody who's watching our videos, if you have any comment, if you have any concerns on yourself, if you have any issues, if you're a little bit confused, if you've been to a doctor, they told you you've got arthritis and that diagnosis has got you concerned, please, we always leave our phone number on our videos. Contact us and I'll try to answer your questions as best as I can. Again, for anybody that watches this video, thank you very much.